All right, so let's begin. This is the agenda for our 7-day training. Yesterday, we did our first day of the training, and basically we focused on understanding the NCLEX world, and we talked about pillars of success that will help you and aid you into passing the NCLEX. On day number 2, we're going to talk about NCLEX category. So today, tomorrow, and day 4, we're going to be talking about NCLEX categories. Okay? You're going to know each category. What do you need to show the NCLEX in order to prove that you're a safe nurse in each one of those categories? And the best of all, we're going to practice NCLEX style questions. All right? So it's going to be very, very interesting. Day 2 agenda, we're going to talk about the distribution of NCLEX content. We're going to talk about how to master physiological integrity and the subcategories included in physiological integrity, which includes basic care and comfort, pharmacological and parenteral therapies, and reduction of risk potential. And in each category today, we are going to practice NCLEX style questions. So we're going to practice about 2 questions for each category, and then tomorrow we will continue with the other NCLEX categories. All right. Thank you for everyone that showed up yesterday supporting our channel. Thank you for that. And today we're going to get into deeper waters, and we're going to start developing that critical thinking and your ability to answer NCLEX style questions. When we talk about the distribution of content for the NCLEX, we have several categories and subcategories. And each one of these categories has a percentage of questions that you can see on the NCLEX. For example, if we look on the upper left, physiological adaptation, you can see about 14% of the NCLEX questions related to physiological adaptation. What does this represent? Basically, if you do a 100 question NCLEX, you could see about 14 questions on the NCLEX on physiological adaptation. We see that reduction of risk potential is 12%, pharmacological and parenteral therapies 15%, basic care and comfort 9%, psychosocial integrity 9%, health promotion and maintenance 9%, safe and infection control or safety and infection control 12%, and management of care 20%. So as you can see, the biggest categories are management of care, physiological adaptation, and pharmacological and parenteral therapies. But do not worry, we are going to discuss each one of them, and we're going to practice questions together. So no more delays. Let's begin with basic care and comfort. So Ray, what do I have to show the NCLEX in order to prove them that I am a safe nurse when it comes to basic care and comfort? Basically, you have to show the ability to provide comfort and assistance with activities of daily living. Now, guys, this comes directly from NCSBN. My wife and we have been to several yearly meetings for NCSBN, and we've had the opportunity to sit there and ask questions, and it has been very, very useful for us in order to prepare our content to teach our students. And basically, according to the NCSBN, the NCLEX, these topics are included in basic care and comfort. Thank you, Mr. Mixel Linares, for supporting our YouTube channel. We appreciate it. So these subtopics or topics are included in basic care and comfort. Assist the client to compensate for physical and sensory impairment. This type of questions deals with assistive devices, positioning, and compensatory techniques. Also, you're going to see assessment and management of client with alteration in elimination, performing irrigations, apply, maintain, and remove orthopedics devices, implement measures to promote circulation, and so on. I'm not going to read each one of this because you can read by yourself, but what I want you to do is write this down. And as you use your resources to study for the NCLEX, like the Saunders book, for example, like I shared with you guys yesterday, what I encourage is that each one of you use the Saunders book or whatever other book that you have, nursing book, and review and study each one of these topics. Now, remember, the key is not to memorize it, but understand it. The photo is a little bit small. I don't know if you have like a tablet or a phone, you can zoom in and see it a little bit better. But also, this is not something that I created. You can find it on ncsbn.org. If you type on Google, NCLEX test plan, the last revision was done in 2019. So use that. Google and go NCSBN NCLEX test plan. Download it and you're going to see what is included in each one of those categories. Guys, everything is out there. I'm not making this up. It's information that NCSBN provides to professors and every candidate that is presenting to the NCLEX. Okay, so what I want to do next, I want to practice some questions. Okay, so let's practice 2 questions about basic care and comfort. So this is question number 1. And as I am reading this question and highlighting or indicating specific keywords, which you learned yesterday, remember the 5 key factors of an NCLEX question. If you don't know what I'm talking about, find day one training of our 7-day training, and you're going to hear the 5 key factors of an NCLEX question. So as I review this question, think about the question and comment on the comment section what you think is the answer. Okay, and why? Why do you think that is the answer? That is the most important thing to do. That way I can read and I can see what is your thinking process. Okay? So the male client is diagnosed with Guillain-Barré syndrome and is in the intensive care unit on a ventilator. So in this question, we don't have a lot of information about our client. The only thing we know that is a male client. We have a diagnosis which is Guillain-Barré. And the patient is in the intensive care unit on a ventilator. This is important because knowing that the patient is on a ventilator can tell you about the seriousness of this patient's condition. Thank you, Mr. Jorge Martinez, for supporting our channel. I appreciate it. Now, read the next question. It says, which cardiovascular rationale explains implementing passive range of motion exercises? Cardiovascular rationale. So the answer that you're looking for needs to have a relationship with the cardiovascular system. So if you're looking at the answer and it's not related to the cardiovascular system, it's the wrong answer. The mistake that students make in this question here is that they automatically go and think about passive range of motion exercise. And yes, that is an important factor of the question, but the answer that we're looking for, the rationale, has to do with the cardiovascular system. So let's review answer number 1. It says, passive range of motion exercises will prevent contractions from developing. And yes, answer number 1 is a good answer because it is true. Passive range of motion exercise help prevent contractions from developing. However, this is a musculoskeletal complication, not a cardiovascular complication. So we can eliminate answer number 1. And once again, I am using the process of elimination. Answer number 2. The client will feel better if he is able to exercise and stretch his muscles. Well, let's think about this one here. The patient is on a ventilator. What this means is that, in Guillain-Barré, we have ascending paralysis. So if a patient is on a ventilator, the ascending paralysis reach the respiratory muscles. So we're looking at a serious condition, so this patient will not be able to exercise and stretch his muscles. That will be active range of motion. And we're talking about passive range of motion. So answer number 2, we can eliminate. Answer number 3, range of motion exercise will help alleviate the pain associated with Guillain-Barré. Well, answer number 3, we can eliminate for 2 reasons. 1, it would not alleviate the pain, and 2, it has nothing to do with the cardiovascular system. So answer number 3 is eliminated. Answer number 4, passive range of motion help to prevent DVTs, deep vein thrombosis, by movement of the blood through the veins. So, are we talking about the cardiovascular system? Is number 4 a cardiovascular rationale of why we will be implementing passive range of motion? The answer is yes. So answer number 4 is the correct answer. I don't know if you are paying attention. From day 1, since yesterday, you have been listening to me on how I analyze NCLEX question. And you're going to see something very important. I analyze the question the same way. It doesn't matter if it's a content question. It doesn't matter if it's a prioritization question. The most important thing for you to do is first identify the key factors of an NCLEX question and then start analyzing answer by answer using the process of elimination. So you are not looking for the correct answer, you're looking for an incorrect answer to eliminate. Would you agree that is not the same selecting the right answer in 4 answer choices than if you eliminate 2 of them and now you're in between 2 answer choices? Now, what is the usual problem? Students analyze, eliminate, and then they get to 2 possible answers, and most times they choose the wrong answer. And that is okay. It's one step at a time. Throughout the training, you will continue to develop your critical thinking and you will select the correct answer more often. Okay? So, answer number 4 is the correct answer. Let's look at another question. This question says, After a prostatectomy, a client is diagnosed with a major complication of hemorrhage and hypovolemic shock. Which of the following is the initial nursing action? There's a few keywords here that are extremely important. The condition, prostatectomy. There's not a lot of information about the client. The client was diagnosed with a major complication of hemorrhage and hypovolemic shock. So we know that this patient is bleeding. This patient has a physiological need regarding airway, breathing, circulation, and specifically circulation. So we know that the client's problem is a circulatory problem. Which of the following is the initial? The word initial tells me that I'm looking for the first answer. We have monitor vital signs, administer a vasodilator to improve the client's blood pressure, administer intravenous fluids, and record intake and output. What an interesting scenario. And answer number 1, or A, monitor vital signs, is an answer that I see very often. Okay? Now, are we going to be doing an assessment like answer number 1? Or are we going to be doing an implementation like answer number or letter C, administer IV fluids? What is the priority action? What is the initial nursing action? Let's use the critical thinking. If you analyze this scenario, you have determined that this is an emergency. And in emergency scenarios, are you thinking about doing an assessment or an implementation? If your patient is in distress, do not assess, implement in most cases. So I'm looking for an implementation. So answer A, I can eliminate because this is an assessment. Recording the intake and output, administering IV fluids, and administering a vasodilator, they are implementation answers. Now, I can continue using critical thinking. And we have two answers that are related to another. For example, the administration of vasodilator and the administration of IV fluids. Each one of these answers is going to do a different effect on the circulatory system. For example, if I administer a vasodilator, what is that going to do to the blood pressure? Is it going to increase the blood pressure, or is it going to decrease the blood pressure? And remember that the patient is in hypovolemic shock. So the patient is going to be hypotensive. The patient is in shock. So I need to do something that increases the blood pressure. A vasodilator will decrease the patient's blood pressure further and will cause more problem. B is eliminated. Now, administering IV fluids. Is that going to help with hemorrhage? Yes. Is that going to help with hypovolemic shock? Yes. So letter C is a very good answer. And D, recording the intake and output. Do we record intake and output in a patient that is in a hypovolemic shock? Yes. Is it the priority? Well, very simple. Ask this question. Between letter C and D, which answer helps the patient's condition? Administering fluids or documentation? Obviously, administration of fluids is going to help the patient more. Remember, documenting is your last action to take. You document once you have done everything that you can do to help the patient. Does it make sense? Okay? Are you learning? Is that critical thinking improving? Are you starting to see different things that you were not seeing before? I hope the answer is yes. And this is only the beginning. Day 2 of a whole 7-day training. You will learn a lot. And like I said, on the first day, you will never think about an NCLEX question the same way. Thank you, Ms. Betty Delgado, for supporting our channel. And thank you, Ms. Alexandra Troncoso, for supporting our YouTube channel. I appreciate it. All right, Lester. Lester asks a great question. Professor, can I administer IV fluids without a doctor's order? Excellent question. And here's the answer. Remember this. For the NCLEX, it is assumed that you have a doctor's order. In other words, you do not have to say, well, let me call the doctor first to ask the doctor if it is okay to administer IV fluids. You have an order already. What you have to do is say, does administering IV fluids, is it going to help my patient with this condition? Yes or no? If the answer is yes, go ahead and do it. You have the right order. That is a very important question. And I am glad, Lester, that you asked that question. Mercy, you make NCLEX seem simple. I wouldn't say it's simple. It's just that it is easier for you to analyze the question. Because if you think about what is easy or hard, simple or difficult, it depends on who's analyzing it. If you're prepared, if you study, if you develop your critical thinking, you're going to say, this is very simple. But if you're not prepared, you don't know how to prioritize, you don't know how to think critically, you're going to see it very difficult. So it depends on who's analyzing. Thank you, Ms. Luz Rodriguez, for supporting our channel with that super chat, super sticker. Excellent. All right. Well, that's a little bit about basic care and comfort. Let's go to pharmacology. Pharmacological and parenteral therapy. You have to show the NCLEX that you have the ability to provide appropriate care in relationship to the administration of medications. What are the topics that are included in pharmacological and parenteral therapy? We have adverse effect, blood products, blood transfusion, central venous access devices, dosage calculation, expected versus side effect, medication administration guidelines and rights, parenteral and intravenous therapies, pharmacological actions and agent, pharmacological interactions, pharmacological pain management, and TPN or total parenteral nutrition. Thank you, Mr. Ismael Ramirez. Thank you for supporting our YouTube channel. Very good, Jasmine. Thank you, Miss Asuka. You're an amazing teacher. I appreciate it. Very humble. I am very glad that you guys are enjoying this training, okay? Very good. So, why is pharmacology so difficult? Pharmacology is one of the most difficult nursing content areas to master. The reason is that there are an enormous number of medications available, a vast amount of information to know about each medication. And this is what I think. I don't think it's possible to learn all the medications, to learn all the side effects, all the adverse effects, the intended effect of every medication. It's impossible to learn all that. And that is the problem. But what can we do to deal with this problem? Because if we focus on the problem, we're done. If we try to find the solution, then we have a chance. So what can we do? And very often, students ask me, Professor, is there a list of medications that appears on the NCLEX? The answer is no. Don't spend money buying a list of medication guide that comes up on the NCLEX, because you know what? Nobody knows. Nobody knows exactly what questions are going to appear on your NCLEX exam. However, there are certain medications or medication categories that appear very often. For example, emergency drugs. Emergency drugs that you give when a patient is having airway, breathing, circulation problem. If the patient is on cardiac arrest, what medications do you give? Anticoagulants, antibiotics, medications like heparin, medications like Coumadin, insulin. And on other trainings, we will go a little bit more in-depth about pharmacology, because I tell you, I can do a 7-day training just on pharmacology, and it will probably not be enough. So we will continue to discuss that in future trainings. But understand this. Focus on the emergency drugs. Focus on medications that you use in emergency situations. And also known high-risk medications. Okay? Also antidotes. They're very important for the NCLEX. So another question that I see students asking is, what do I have to study? Generic or brand names? Do I have to know the generic names or brand names of medication? And that is a very, very frequent and common question that I see in students. Thank you, Mr. Lester Pinara, for that super sticker. I appreciate it. Thank you, Ms. Yolanda Pantojas, for supporting our YouTube channel. Thank you. Areli, you should do, Professor, a 7-day training on pharmacology. That would be amazing. Hey, maybe we can do that. If everybody wants to do that, we'll do it. We'll find another time to do another 7-day training. Like I said, I really want to help you guys out. I think that all of you need a lot of help. And if I can do something to support and help the community, I am willing to do that here in our YouTube channel. Help other people at the same time. My channel grows as well, and the academy grows. So I think we help each other out. So we will do that. No problem. Thank you, Ms. Elizabeth Saldana, for supporting our YouTube channel. So what do I have to learn, Professor? Generic or brand drug names? Well, accordingly to the NCSBN, at this time, they will use generic medication names only. However, in certain scenarios, they could use a brand name, but if they do use a brand name, they will give you the generic name as well. So if I were you, I will study the generic medications. And the reason is because for one generic medication, you could see 5, 10 different brand names. And you're not going to have time to learn all those brand names. So I am glad that the NCSBN, the NCLEX, made that decision to only include generic names and not brand names. All right, so let's talk about assessment when it comes to pharmacology. Because as you know, accordingly to the nursing process, assessment is the first step of the nursing process. Do not confuse that with that assessment is the priority all the time. That is a big mistake. Assessment is the first step of the nursing process, but is not always the priority. That is an assumption that you cannot make. It depends on the scenario. But let's talk about assessment and pharmacology. One of the most important assessments to do is assessment of allergies and hypersensitivity to medications. Many medications, clients can develop allergic reactions. So it is very important to ask and determine in the client's clinical record if the patient has an allergy to a certain medication group. It's important to assess the client for any existing medical disorders that would be contraindicated in the administration of a certain medication. Assess for potential interactions related to medication. In other words, if the patient takes over-the-counter medication, does it interact with a prescription medication? Is there any contraindications or potential interactions between a prescribed medication and, let's say, a tea that a patient takes, or herbal remedies? Assessment of laboratory results. For example, if you're giving potassium, if you're giving magnesium, you need to check the laboratory results, because otherwise you can give a patient a medication that you can cause damage to that patient. You can injure that patient. For example, there are certain medications like, let's mention one of them, heparin, coumadin. You have to check certain lab values. And I don't know if you know the answer to that. So what is the lab value that you have to check if you will administer or you are administering heparin to a patient? That is a good NCLEX question. What is the lab value that you have to assess if you're giving a patient warfarin or coumadin? Let me see the chat. What do you think? Let me see if I have a sharp group today, tonight. See, Jeanette says PTT and PTINR. Okay, Jasmine says PTT for heparin, PTINR for coumadin. All right, excellent. So you have to know the relationship between laboratory results and medication. Also, vital signs. For example, if you are administering an antihypertensive drug, you're giving a medication for high blood pressure. So what is a vital sign that I have to assess? Well, I have to assess the blood pressure. If I am giving a medication that interacts with the heart rate of the patient, for example, if I'm giving a beta blocker, I have to assess the patient's pulse. If I'm giving digoxin, I have to assess the patient's pulse. So you have to know the relationship between vital signs that you have to assess and a medication administration. You have to assess for intended effect, side effect, adverse effect, and toxic effects of medication. And there is a difference between these subjects. Intended, side effect, adverse effect, and toxic effect are not the same. We will talk about that in the next few minutes. Thank you, Ms. Beverly Calanya, for that super sticker. Thank you for supporting our YouTube channel. I appreciate it. All right, so you have to read the question carefully and identify first the key factors of an NCLEX question, but also you have to think about something very particular to medication. Okay, we know about reviewing and identifying demographic information such as age and gender. Who is your patient? What is your patient's medical history, family history? But now with medication administration, we have to add something else. Allergies to medications. And we're going to add something else. Do I have information on the stem of the question that talks about vital signs, that talks about laboratory results? Remember, if you see that on the stem of the question, you see a medication, it's there for a reason. Now you have to think a little bit more in depth when you are reviewing and identifying the key factors of the NCLEX question. It's a little bit more advanced in pharmacology. Look for keywords such as intended, side effect, or adverse effect. But watch out. Sometimes it does not include intended side effect or adverse effect or toxic effect, but the sentence describes an intended side effect, adverse effect, or toxic effect. And most important, continue to use the process of elimination and critical thinking strategies to answer the question. I will tell you, when I took the NCLEX, I had a lot of difficulties in pharmacology. I had 3 problems, and maybe somebody can relate to me. I had pharmacology problem, I had maternity problem, and I had nutrition problem. I don't know why, but I struggled greatly with each one of these topics that I just mentioned. I'm talking several years ago. What did I do? I knew that I couldn't develop content overnight. And I didn't have much time to prepare for the NCLEX. I had a family that I had to support. And I needed to pass the NCLEX quickly. So I studied for a month. That's it. I didn't have more time. And I did the best I could to develop the critical thinking. And the critical thinking and prioritization strategy helped me overcome the lack of knowledge that I had in certain areas. Like I said yesterday, I'm not saying don't study, throw the book away. What I am saying is that if you develop this, that I'm telling you, critical thinking and strategies, you will do okay. But you have to use both in combination. Content and the application of nursing knowledge with critical thinking. So let's go into further detail about intended effect, toxic effect, adverse effect, and side effect. If you know the difference between these 4 subjects, you will learn to respond most of pharmacology NCLEX question. And I'll tell you this, if you develop this strategy that I'm going to teach you next, you will be able to answer some pharmacology questions even without knowing the drug. Because sometimes the drug is irrelevant to the question and the reason of why the question was created. For example, if I'm talking about what is the most important action to take, and one of the answers says, ask the patient for allergies, does it really matter what the medication is? If one answer says, call the doctor, the other answer says, give the medication in the morning, the other one says, check the pulse, and the last answer says, ask the patient for allergies of this medication. Do you really need to know the drug category? Do you really need to know everything there is to be known about that medication to answer that question? No, because the question is a safety question. The question is, you have to ask the patient for allergies to medications. Because guess what? If the patient has allergy to that medication, I will not be giving that medication. So is it relevant to call the doctor first? Is it relevant to check for the pulse? Is it relevant to check for the blood pressure or whatever? So what I'm saying is, if you are reviewing an NCLEX question that has to do with pharmacology, and you look at the medication and you say, oh my God, I don't know that medication, do not give up. Continue reading. Continue using your critical thinking and see where you get. Because it is better to use critical thinking than to say, I don't know, A, B, C, D, C. Okay? Don't do that the day of your exam. So let's learn about the difference between intended, side effect, and adverse effect. An intended effect is the desired and expected effect of a medication. For example, if I give a patient morphine sulfate, the intended effect that I want out of this medication in a patient that has pain is to relieve the pain. That is the intended effect or reason of why I'm giving a medication. On the other hand, when we talk about a side effect, is a physiological effect of the medication that is unrelated to the intended medication effect. It is something that the patient could experience after administering a medication. Okay? So, a side effect is a physiological effect of a medication that is unrelated to the intended medication effect. An example of this, let's say you're giving a patient an antihistamine medication. What is a known side effect? Drowsiness. You're not giving the antihistamine to produce drowsiness. That is a side effect. Now, when we talk about side effects, and I see books making these mistakes all the time, they confuse side effect and adverse effect. It's not the same thing. Side effect is usually not life-threatening. And usually you can relieve or alleviate the discomfort associated with that medication very easy. In other words, a side effect is an effect of the medication that is unwanted, but that effect does not cause, it's not going to injure my patient greatly. It's not going to cause a life-altering condition. And I'll give you an example. Let's say you give a patient morphine sulfate. We talked about morphine sulfate already. We talked about the intended effect being to relieve pain. But what is a common and expected side effect? Constipation. Can you treat constipation rather easy? Yes. Increase fiber and more water intake. So yes, it's a expected side effect of the medication, an unwanted one, but does not cause life-altering injuries to the patient. It can be taken care of easily. On the contrary, An adverse effect is more severe side effect and always has an undesirable effect. For example, let's talk about sulfonamide. An adverse effect is hypersensitivity to that medication if a patient is allergic to it. The patient can have rash, fever, and shortness of breath. Another example is anaphylaxis. It's an adverse effect, and it cannot be treated easily. A side effect can be treated easily. An adverse effect cannot be treated easily. And we probably need a healthcare provider, a nursing intervention to help the patient with that adverse reaction. Otherwise, the patient could die very, very soon. So as you're reviewing a pharmacology question and they tell you which of the following side effects is expected in this medication, you're going to be thinking, okay, a side effect is something common that a patient can experience, but it's something that can be treated easily and it's not going to cause life-altering situations on the patient. On the contrary, if it says which of the following is an adverse effect of the medication, then you're looking at something serious, something that if you don't treat very quickly, the patient could experience a life-threatening condition. Thank you, Ms. Giselle Nunez, for the super chat sticker. Thank you for supporting our channel. All right. So this is getting very interesting. We're going to continue practicing a few more questions. I hope that you are excited about day 2 of our Pass the NCLEX step-by-step 7-day training. What do you think so far? If you've liked what you heard so far, what have you seen so far, go ahead and click the like button on this video. Help me with YouTube algorithm. Show YouTube that this training is beneficial to you and to other nurses. Help me by liking this video and also share this video with other nurses. But don't go anywhere. We're not done. We're going to continue practicing some questions together. We're going to take everything that I've said so far about pharmacology and see it on an NCLEX style question. Sarai, awesome. Mr. Patel, yes, thank you, sir. Best one ever. Darlene, I'm learning a lot. Excellent. Louis Brown, I love it. Awesome. Thank you for the support. Miss Mara, very beneficial. Thank you so much. Miss Ariana Morales, thank you for the donation. Thank you for supporting our YouTube channel. I appreciate it. Miss Deborah, thanks a lot. Thank you too. All right, excellent. So let's continue. Let's review a question together. It says, the nurse notes that the primary healthcare provider has prescribed sulfametazole and trimethoprim for a client. Which priority action should the nurse take before administering this medication? Which priority action? So which priority action means that this is a priority question should the nurse take before administering this medication? So there's not a whole lot of information about the patient. All we know is a medication that was prescribed, and we have to take an action before giving the medication. So ask the client about an allergy, call the pharmacy to obtain the medication, inform the client about the need to increase fluid intake, check the medication supply room to find out whether the medication needs to be obtained from the pharmacy. Wow, what an interesting scenario. So what is my priority action in this scenario? Answer number 1 says, ask the client about allergy. So what is answer number 1 has to do with? 1, the patient. 2, safety. Medication, safety. What about answer number 2? Call the pharmacy to obtain the medication. This deals with the medication. Answer number 3, inform the client about the need to increase fluid intake. Wait a second. So we have a situation. The stem of the question says, what is the priority before giving the medication? Do I really have to be teaching the patient about increasing fluid intake now? Can I do that later on? Yes. So that's not my priority. Answer number 4, check the medication supply rooms. In other words, check the room. Find out about the medication. So we have answer number 1, the focus is patient and safety. Answer number 2, the medication. And answer number 4, the supply room and the medication. So what is the priority? The priority is my patient and whether the patient has an allergy to this medication or not. If you look at this question, and this is the scenario that I was telling you about, the medication is irrelevant. It could be Tylenol. It could be acetaminophen. Whatever. The focus of this question is safety. And my priority nursing action is to determine if the patient has allergies to this medication. But it could be any medication. But maybe you're reviewing this question and you don't know about sulfametazole. You don't know that this medication is given to treat bacterial infections. But in reality, to answer this question, you don't really need to know a whole lot about sulfametazole, at least in this scenario. Okay? All right. Let's review a select all that apply. I know a lot of you have been communicating with me in our Telegram group about select all that applies. And although I'm not going to go into in-depth about select all that apply, I want to share with you this scenario. And I want you to start thinking about the proper steps to follow in a select all that apply. However, I'll tell you this. Most select all that apply questions, they are content related. In other words, many of them are content style questions or recall and recognition style questions. There's usually not a whole lot of critical thinking that take in place in a select all that apply question. However, in this scenario, we can use some critical thinking in this select all that apply. So read this question with me, analyze this question with me. Tell me in the chat, comment on the chat, what is your answer? And let me talk about SARAS or select all that apply. The first misconception that I have heard with my students about select all that applies. Select all that apply is a right and all or nothing scenario, meaning if the NCLEX determines that there are 3 correct answers and you select 2 correct answers, is wrong. If the NCLEX determines that there are 3 correct answers and you select 4, is wrong. You have to select exactly the right amount of answers in order for the question to be answered correctly. Now, taking that into consideration, let's review this scenario. The nurse is caring for several clients on the respiratory unit who are receiving beta adrenergic agonist, bronchodilator, albuterol in the prescribed nebulizer treatments. Which side effects, important keyword, which side effect would the nurse expect to assess following administration? Select all that apply. So remember what I taught about side effects versus adverse effect. So a side effect is an undesired expected effect of a medication that can be treated and usually is not going to cause a life-threatening condition. So let's review answer number 1. And I see several of you selected answer number 1. Increase tachypnea. So increase the rate of breathing. If we're giving a bronchodilator, albuterol, you have to think of first, before we think of the side effect, what is the intended effect? Why am I giving albuterol? In many cases, could be to treat wheezing, difficulty breathing. It's given in many conditions. It's given in COPD, chronic obstructive pulmonary disease. So, what is the expected therapeutic effect of a bronchodilator? If a patient is having difficulty breathing and we give a bronchodilator, a medication that is going to dilate the bronchioles, the patient is going to be able to breathe better. So we are not expecting a higher respiratory rate or tachypnea. We are expecting a decrease in the rate of breathing. So answer number 1 does not make sense to the intended effect of the medication. Now, irritability and nervousness, shakiness, we see that as a side effect of albuterol, of a bronchodilator. So answer number 2 is a definite correct answer. Now, what do we see in patients that take albuterol, a bronchodilator? We see that the heart rate goes up. So we see tachycardia. This is why in patients that are already tachycardic, we have to be careful when we're giving this medication. So tachycardia is a side effect of this medication. Increase somnolence. And I want you to compare answer 4 and 5. Because they are opposite to each other. And this is a strategy that I use in Select Other Applies. I try to find if there are answers that are similar or opposite to each other. So, what can this medication cause? Somnolence or insomnia? And look at the other answers. Irritability, nervousness. You think the patient is going to be with somnolence or insomnia? If you see irritability, nervousness, and tachycardia. And answer number 6, anxiety. So if you think about this, irritability and nervousness, tachycardia, insomnia, and anxiety, they're kind of related to each other. Think about it. And it is opposite to answer number 4, somnolence, which is the opposite. of a patient that is wide awake or very awake. Therefore, answer number 2, 3, 5, and 6 are the correct answers. We eliminate answer number 1 and answer number 4. And this is the scenario that I was giving you. Let's say in your answers you selected 2, 3, and 5, and you forgot answer number 6 is wrong. Let's say that you selected 2, 3, 5, 6, and 1. Wrong answer, because you selected an incorrect answer. So it is an all or nothing scenario. Starting April 2023, it's going to change. The NCLEX will be different, and the way they're going to calculate if a question is right or wrong is different than the way they do it now. But we cannot worry about 2023 yet, because we're in 2022. So let's continue. Reduction of risk potential. And this is the last category that I want to share with you on day 2 training. Reduction of risk potential refers to the nurse's ability to decrease the potential for clients to develop complications or health problems related to treatments, procedures, or existing condition. Now, what are the topics that are included according to the test plan on reduction of risk potential? Diagnostic test, monitoring conscious sedation, potential for alteration in the systems of the body or in body systems, tests, treatments, procedures, potential complications related to a diagnostic procedure, system-specific assessment, therapeutic procedures, vital signs, and lab values. So all of these topics are included in reduction of risk potential. Now, let's review a priority question related to this category. Here's the question. Crystal, guys, isn't today supposed to be day 2? Yes, Crystal. It is day 2. I just had issues with the technology at the beginning, and for whatever reason, the video that I had originally created for day 2 didn't work on YouTube, so I had to use the day 1 link in order to start live. Otherwise, you guys were going to be waiting the whole afternoon, and I did the best thing I could to start the live as soon as possible. So that is why you see on the title day number 1. However, I will change that after the live YouTube training, and it will say the right title, day number 2. Okay? So to confirm, we are on day number 2 of our 7-day training. Okay? I hope that clarifies. Crystal. Okay, perfect. So the nurse is caring for clients on a medical floor. Which client is the highest priority? A strategy that I like to use when I see a question that gives me 4 different patients, I try to identify which patient is stable versus unstable. I try to identify if there is a patient that has an acute condition versus a chronic condition. I try to identify if there is a patient that has some kind of airway, breathing, circulation compromise. So as I review my answers, I try to think about that. So patient A, 84-year-old exhibiting uncontrolled atrial fibrillation. Letter B, 60-year-old exhibiting asymptomatic sinus bradycardia. So let's compare A and B, and I like to do that. I like to compare one patient with the other and start eliminating. Remember, I always use the process of elimination. So if I compare A and B, who is worse? Uncontrolled atrial fibrillation or asymptomatic sinus bradycardia? So the word asymptomatic tells me that the patient is not experiencing any symptoms. So I think B we can eliminate. Notice, I'm not looking for the right answer yet. The only thing that I do was compare A and B. So now B is out of the way. I will compare A and C now. A says 84 uncontrolled atrial fibrillation. C says 53-year-old exhibiting ventricular fibrillation. Oh, we got a problem. Because we know that ventricular fibrillation is a deadly dysrhythmia. This patient needs CPR and defibrillation soon. So A and C is in a worse condition or a more unstable condition. So I eliminate letter A. Now I'm going to compare C and D. D, 65-year-old exhibiting supraventricular tachycardia. This is a big problem as well. But notice the word supraventricular or above the ventricles. So what is a worse scenario? Ventricular fibrillation or supraventricular tachycardia? Ventricular fibrillation is the worst condition. So the answer is C. Now, you may look at this question and say, oh, professor, this is easy. I know ventricular fibrillation is the answer over supraventricular tachycardia, over asymptomatic sinus bradycardia, over uncontrolled atrial fibrillation. However, I am teaching you thinking process. Use the same process in whatever the topic or situation. The problem that I see many of you have is that you do not have a system. You fail to analyze questions the right way. And the only thing that you're using is content. When the questions gets more difficult, when the scenario is not as clear, you don't know what to do. I'm teaching you the steps first. I want you to improve the critical thinking process. I want you to have a system at your side, and then we will review harder questions, a more difficult scenario. But this is the starting, this is the beginning steps. Because if I start giving you super difficult scenarios, you'll be like, I don't know what I'm doing. I'm lost. And we got to take baby steps. Okay? So let's review the next question. The nurse is caring for a 7-year-old child who has undergone a cardiac catheterization 2 hours ago. So they're giving us information about the child, 7-year-old. The procedure was a cardiac cath 2 hours ago, so pretty recent. And when the nurse goes to see the patient, when the nurse checks on the patient, she finds the dressing and the bed saturated with blood. So we have a bleeding problem. Saturation or saturated with blood means bleeding. What is the first action to take? Once again, we have assessment, we have implementation, we have implementation in letter C, and implementation, calling the doctor. See, many students, they take the approach of calling the doctor. It's the easiest thing to do. However, learn this. If you have a scenario that you have an option to call the doctor, ask this first. Is there something that I can do? Is there something within my scope of practice that as a nurse I can do to help the patient? If your answer is yes, there is something that you can do to help the patient, do it before calling the doctor. In other words, in this scenario, if I do A, B, or C, does those answers help the patient? Yes or no? And yes, there is an answer that helps the patient. So therefore, calling the doctor is not my first intervention. So I have A, B, and C. I have an assessment answer that says assess vital signs, and I have two implementation answers. And let's think about the process of critical thinking. I told you, if it's an emergency, do not assess, you need to implement. This is an emergency. The patient is bleeding. There is saturated blood on the dressing and on the bed. We have to do something to assist the patient with bleeding. Therefore, I will eliminate assessment of vital signs. Now I have B and C. Which answer, B or C, is going to help stop the bleeding? Letter C will help stop the bleeding. Apply pressure to the catheter site will help stop the bleeding. Therefore, answer C is my first action over A, B, and D. All right, guys. If you haven't subscribed to our channel yet, it is very important that you do so. As you could tell, I had technical difficulties today, so if you weren't subscribed to the channel and you didn't have the right link, you couldn't see the training today. So it's very important that each one of you is subscribed to our YouTube channel so you don't miss any information. That is the most important action to take today so you don't miss future training, okay? Other trainings that I will be doing in the future and the other training days that we will have for the remainder of the week. Also, I have created a Telegram channel group. I see that a lot of you are not in this Telegram group. If you have the Telegram application, go ahead and go to the comment section on this video and find the link to the Telegram group and join our Telegram group, because in this group every day I put information. I put the link of the videos so you don't miss any of the valuable informations that I will be sharing with you during the training and after the training. Thank you, Mr. Martinez, for the donation and helping our YouTube channel. Are you ready for day 3? Remember, we will start tomorrow, 5 p.m. Same YouTube channel. Tomorrow morning, in the Telegram group, I will share the agenda for tomorrow and I will share the link with all of you guys. All right, well, 6:22, so it took us a little bit longer than expected. Or like I told you at the beginning, it was gonna be like that. It could take us a little bit longer because I wanna make sure I finish the whole presentation. It doesn't matter if it takes me an hour and a half or 2 hours. I will give you the whole presentation and I'll do the best I can to help you with your NCLEX preparation. Remember that you can see this video recorded later on, listen a little bit more in detail, okay? And really learn this critical thinking that I'm trying to teach you. Thank you, God Loved, for the donation for our YouTube channel. I appreciate it. Thank you, thank you, thank you. Crystal, you can find the group in the comment section. On the video, find the comment section. It will be there. On the description. I think it's on the description. Julie, yes, we will do more selector that applies. I don't know if my advisor is here. Can you share on the comment section the link for the Telegram group so the students that are not there, they can join, please? Thank you, Miss Areli Montero, for the donation. Thank you for supporting our YouTube channel. Maritza, SATA it stands for Select All That Apply. It's just an abbreviation that students use. Senat, is there enough time to think critically before answering the question when taking the NCLEX? Yes, there's more than enough time. Remember that it seems that you're taking a long time now. First, because I'm explaining it. So it takes longer to explain than to apply. And also, as you develop your critical thinking and you practice, you will do it rather quickly. For example, a prioritization question, I can analyze it the right way with critical thinking in 2 minutes, less than 2 minutes. Depends on the question, but it can be done. And remember, you have several hours to take the NCLEX. So you don't need to be rushing. Okay? Miss Benita Vialet, thank you for your donation. Thank you for supporting our YouTube channel. Lois Brown, I don't really know how it's done. I just see the students doing it. I think there's like a icon, like a money icon or something like that. If you are connected to YouTube, I don't know if they ask for your payment information. Like I said, I've never done it, but I see the students doing it all the time. Maybe if somebody can explain on the chat how to do it, that way the other students that want to donate to the channel, they can do it, because I don't really know how the process is, to be honest with you. Yes, everybody, please don't forget to like the video. It's important. And share the video with other nursing students. Okay? Don't forget to do that. All right, guys. So I'm going to take off. Thank you for being here. See you tomorrow at 5 p.m. Eastern Standard Time, day 3 of our NCLEX training. God bless you. Take care. Bye-bye.